Hello and welcome to New Mexico Rising. My name is Dan. You know, each and every week we try to talk to people from across the country about things you could do in your neighborhood. And on this week's show, we got this.
We just come off the back of a strike, so every bit helps.
Yeah, exactly.
Don't be afraid to ask for help and get to know the resources and tools that are available for you.
All of that and more right here on New Mexico Rising.
Durante este momento de regreso a la escuela, los médicos de familia enfatizan que las vacunas son seguras, efectivas y salvan vidas, dado que el número de los niños en kinder completamente vacunados han bajado. Doctora Diana Hayworth se une a nosotros para hablar sobre la importancia de las vacunas. Bienvenidos, doctora Hayworth.
Muchas gracias por conversar esta mañana sobre las inmunizaciones. Quisiera primero enfocarme diciendo que las vacunas funcionan. Las vacunas son seguras, son efectivas y sí, salvan vidas. La realidad es que la mayoría de nuestra población en este momento no recuerda cómo era la vida cuando no teníamos las vacunas. Las vacunas han salvado millones de vidas y han avanzado críticamente la salud pública. Tenemos que saber que las vacunas han sido sometidas a rigurosos test y investigaciones para asegurarse que sean seguras cuando lleguen a acceso al público. Han tenido muchos exámenes para saber que sean seguras al momento de recibirlas. Si alguien nos dice que no queremos recibir una vacuna porque nuestro sistema inmunológico está bien, les diría de que cuando recibes la inmunización no solamente te estás protegiendo a ti, pero también estás protegiendo a la gente que es más vulnerable. Estamos hablando a los que no se pueden vacunar. ¿Quiénes serían? Los recién nacidos y la gente que tiene un sistema inmunológico muy débil. Cuando recibes tu vacuna, creas una comunidad de inmunidad.
¿Qué le diría a alguien que está indeciso sobre vacunar a sus hijos, sí o no?
Lo importante de hablar con la vacunación, especialmente en nuestros niños, es, por ejemplo, hablando del sarampión, ¿no? El sarampión es una enfermedad que se dice preventiva. Esto es una realidad. ¿Qué significa que es preventiva? Significa que tenemos una vacuna que usted puede recibir y vamos a prevenir que usted desarrolle los síntomas severos, que sea hospitalizado o que muera a causa de ello. Segundo, que nosotros sabemos que el sarampión ha sido erradicado en los Estados Unidos hace varios años porque la gente estaba usando la vacuna. Lamentablemente, después de la pandemia, las tasas de inmunización de vacunas, especialmente las infantiles, han bajado muchísimo. Y esto ha ocasionado abrir la puerta de muchos casos nuevos de enfermedades preventivas, que una de ellas es el sarampión. Ahora, malas noticias para nuestra comunidad porque muchos niños han sido hospitalizados debido a eso y 2 han fallecido. Tenemos 2 muertes de niños, no porque ellos no tuvieron acceso a la vacuna, sí tenían acceso, pero fue porque los padres decidieron no vacunarlos. Es importante como padres saber que ustedes, al no vacunar a sus niños, no solamente los estamos poniendo a riesgo a ellos, pero a la gente que está alrededor de sus niños. Buenas noticias, papás, mamás. Ustedes pueden tener el poder de proteger a sus niños. ¿Qué tienen que hacer? Hacer una cita con su médico de medicina familiar para que reciban su vacuna de sarampión que se llama MMR.
Hay mucho ruido sobre las vacunas y la salud en este momento en las redes sociales y todas partes. ¿Cómo ayuda a los pacientes a separar la mito a la realidad?
Hay muchos mitos con respecto al tener acceso y qué vacuna es recomendada para cada persona, ¿verdad? Nosotros sabemos como médicos de medicina familiar que nuestros pacientes y sus familiares cuando llegan a la visita médica tienen las mejores intenciones para su familia y los quieren proteger. Pero lamentablemente hay mucha información en los médicos de comunicación que confunden y que nos llevan a otro camino y nos hacen pensar de que tal vez las vacunas no sean necesarias, lo cual no es cierto. Así que quisiera decirles, ustedes necesitan conversar con su médico de medicina familiar, su médico primario. Traigan todas esas preguntas, todas esas dudas sobre la vacunación. Nosotros vamos a responder esas preguntas con evidencia científica que les puede decir y asegurar qué vacunas son seguras, no solo para ustedes, pero para toda su familia.
Todos queremos cuidar la salud de nuestra familia y hacer lo correcto. ¿Cuál preguntas pueden responder los médicos de familia sobre las vacunas?
Bueno, los médicos de familia nos encargamos de ver a los recién nacidos, niños, adolescentes, adultos y adultos mayores. Nosotros podemos darle las mejores recomendaciones para cada miembro de su familia. Le podemos decir qué vacuna le corresponde y en qué momento se le debe recibir. Nosotros podemos decir cuáles son indicadas para antes de que empiece la escuela o si van a estar en la temporada de invierno, cuáles son las que son indicadas. Vamos a revisar su historia médica y le podemos explicar cuáles son indicadas, qué efectos adversos tiene cada una. Y los efectos adversos son leves. Quiero que entiendan eso. Es muy seguro recibir una vacuna. Y cuando tienes algún efecto adverso, significa que tu sistema inmune está respondiendo, que la vacuna está funcionando.
Para los que quieren aprender más sobre las vacunas, ¿dónde pueden encontrar recursos adicionales?
La Asociación Americana de Médicos de Medicina Familiar ha desarrollado una página web que tiene muchos recursos para nuestros pacientes en español y en inglés. La página web es doctordefamilia.org o familydoctor.org. Pueden revisar información y traerla a su siguiente cita con su médico primario. Queremos que ustedes sean defensores y aboguen por ustedes y la salud de su familia.
Muchas gracias, doctora Diana Howard.
Gracias.
Back to school can feel overwhelming, from planning meals to keeping kids healthy. Lifestyle expert and author Meaghan Murphy is here with her Back to School Prep 101. Simple ideas for food, snacks, and more. Hey, Meaghan, welcome.
Yay, thank you for having me.
Can you give us a few ideas for after-school snacks kids will actually want to eat?
Sure thing. So I have 3 kids. They're 15, 13, and 12. And one of their favorites is Frollies. These are a sweet treat made with fruit juices and real purees. There are no artificial colors, no artificial flavors. They've got a real smooth sorbet-like texture, which is just delightful. There's the strawberry flavor, the watermelon flavor, and they have little bits of chocolate for that crunch. My daughter loves the pineapple version, and you can go to frollies.com to find the store, to find the store near you. I get them at my local Target in New Jersey.
And how about foods that can double, something for dinner that also works great in the lunchbox?
So I love a company called Real Good Foods. I have a food allergy. I can't eat gluten. And Real Good Foods is so wonderful for anybody who has food issues. They have a lightly breaded dino nugget that are gluten-free, grain-free, no refined flours, no artificial additives, made with simple ingredients, 13 grams of protein per serving. It's just a fun, clean label twist on a kid's classic. These are great hot in a thermos for a lunchbox, for school lunch. My big kids, the teenagers, will put these in the air fryer for an after-school snack. Also really great to get on the dinner table quickly on a busy back-to-school night. I put them in the air fryer. You can have dinner on the table in 8 minutes or less. This is a really great find from Real Good Foods.
And with the school year also comes cold season. What should parents keep on hand to be ready?
So this is a good one. This is called Cold Calm from Boron. And this is a line of homeopathic cold medicines. It really targets specific symptoms of the cold. So congestion, runny nose, minor sore throat. And there are no artificial colors, flavors, preservatives, no phenylephrine. It's non-drowsy. It's not habit-forming. And it's something I keep in my purse. I will take the melt-away tablets, and the second I'm like, oh no, is that a sore throat? And I will take the melt-away tabs, and it really helps my body fight the cold. There's also the single doses for kids, really, really good, from boronusa.com.
And where can families go find more details on everything that you've shared today?
Sure. So go to frollies.com for the Frollies. You can go to realgoodfoods.com and boron, BOIRONUSA.com.
Thank you so much, Meaghan, for joining us today.
Thank you, Abby.
Parents know back to school season can bring stress for kids, but sometimes that stress can connect to bigger issues like mental health and making safe choices. The CDC has launched a new campaign called Free Mind to help families talk about it and support teens. Today, we are joined by Dr. Grant Baldwin, Director of the CDC Division of Overdose Prevention. Welcome, Dr. Baldwin.
Thank you so much. It's a pleasure to be here.
Can you explain the connection between mental health and risky decisions teens may face?
Yeah, so as our teens face stress, anxiety, worry, and even bouts of depression, we need to make sure our teens are turning away from substances and turning towards healthy coping strategies. We find ourselves in a mental health crisis where 4 out of 10 American high schoolers report feeling persistently sad or hopeless for over 2 weeks, and 1 in 5 have reported contemplating suicide. And if you do turn to substances, there were real consequences of that immediately and long term. So immediately, the environment is rife with fentanyl and counterfeit pills laced with fentanyl. So use of substances could result in overdose or death on just a single use. And long term, we know that there's an association between early substance use initiation and problematic use into adulthood, including addiction and a range of other health problems. So it's critically important to intervene early.
And what are some of the warning signs parents should look for when it comes to their child's well-being?
Well, as a parent myself, we all know our teens best. So you should look for things like change in mood, irritability, your teen being withdrawn more than they might otherwise would be. If school has started, a drop in school performance that you weren't anticipating, sudden loss of weight or weight gain, these are all signs that your teen may be struggling with their mental health, and really a call for us to have a kind of a judgment-free conversation, an open-ended conversation where our teens feel heard and listened to and safe. And ultimately for us as parents and caregivers to make a connection to a licensed professional counselor or social worker or other resources that can meet our teens where they are and provide them with the support they need. And this might include calling a crisis line like the national 988 line.
And what advice do you have for parents who may feel unsure about how to start these talks?
Yeah, it takes a lot of courage to have them. And that's one of the reasons we stood up the Free Mind campaign. So if folks go to cdc.gov/free mind, parents and caregivers can see fact sheets and conversation starters about how to have these conversations. And for teens themselves, the campaign is really teen-centric, teen-appropriate. And the core message is one of teen empowerment, personal agency, where we recognize that teens are the captains of their own ship. And importantly, it teaches about the connection between substance use and brain development, but even more so that it's okay to not be okay, that you should reach out to a parent and caregiver to get the support that you need. Part of how we do that is we've got a range of tools and resources for teens themselves, including an interactive card game, a graphic novel, a bunch of videos, all things that are going to be incredibly appealing to teens and hopefully set them up to have this crucial conversation with their parent or caregiver and make sure that they are able to meet a mental health crisis should it be occurring, or otherwise develop healthy coping skills that we all need as we grow into adulthood.
And one more time, where can families go for more resources?
Yeah, folks can go to cdc.gov/free mind. And it's really important for teens to remember they're not alone and for parents to remember that they're not alone. That's what the Free Mind campaign helps reinforce.
Dr. Baldwin, thank you so much for joining us today.
My pleasure.
Back to school usually means new shoes, backpacks, and a long supply list. But for many families, the real sticker shock is happening at the pharmacy. From insulin to EpiPens, the cost of life-saving medications keeps climbing, and it's putting a real strain on parents. So joining us today is JD Hayworth, here to share what's driving these prices hikes and what we can do all about it. Welcome to the show, JD. How are you?
And great to be with you and honored to have the chance to speak with all our New Mexico neighbors.
All right, so how are rising prescription drug costs affecting families pretty much right now?
Well, you mentioned in your intro to our interview EpiPens, for example. Listen to this. A year ago, the price of an EpiPen was about $100. Fast forward to this year, $650. Or inhalers. Realize Americans are paying 9 times what our European counterparts are paying. Indeed, overall, Americans are paying on average 3 times the price of prescription drugs in the rest of the developed world. That's putting Americans last, not first. And this is not a Republican or Democrat issue. It's an American issue affecting the family, as you mentioned.
And some of these drugs just haven't changed in years, yet the prices keep going up. Why is that?
Well, I don't mean to be cheeky, but Big Pharma does it because they can. For example, hundreds of life-saving medications. As 2024, as we flip the calendar to 2025, there were price hikes far outstripping the rate of inflation. So Big Pharma is the culprit, and in a survey conducted for the Pharmaceutical Reform Alliance, 85% of the American people get it. They say Big Pharma is the problem, nobody else, because of their focus on profits.
So what are we seeing in public opinion when it comes to affordability on these medications?
Well, again, they are clamoring for the prices to be brought down. In fact, 67% of Americans in that same survey said they feel as if they've been personally taken advantage of, and over half the people responding in the poll said they know someone personally, either in their household or someone in their social circle, who has to make a choice. Is it the rent? Is it food, or is it the price increase? Now, look, nobody's opposed to profit, but there's a difference between profit and profiteering. And when you have Big Pharma on average making twice the profits as the profit margin on average for the other S&P 500 companies, the answer is clear. Those prices have to come down.
So what real solutions could help make prescriptions a little more affordable?
Well, first of all, good news is the administration, on a nonpartisan basis, issued an executive order for most favored nation status. And like a lot in Washington these days, it flips the script. It says, hey, let's make the United States the most favored nation. Let's make sure that the other countries, the consumers in other countries, are paying their fair share, and Americans pay less. So obviously, getting that done is the key, not through the heavy hand of government, but through hard-nosed negotiations, and Congress needs to come alongside the administration. Number two, we need to end some of the anti-competitive practices, the delays in bringing generics to markets, keeping prices high, keeping some drugs off the market. And the third thing is we need transparency. When Americans realize that billions are being spent on direct-to-consumer advertising, but less than half that type of money is being spent on research and development by Big Pharma itself, they will demand a change.
And for parents and families who want to get involved, maybe learn more, where should they go?
Glad you asked. The website, pharmareformalliance.com. That's pharma with a PH, pharmareformalliance.com.
JD Hayworth, thanks for joining us this morning.
And great to be with you.
Heading off to college or starting your first job comes with a lot of planning, moving, or setting up a place to live and figuring out the basics of adult life. But one thing that often gets overlooked is healthcare. Making the shift from a pediatric doctor to managing your own care can be a huge challenge, especially for young people with chronic conditions. So joining me today are Lucille Aceta, Chief Pharmacy Officer and Head of CVS Specialty Operations for CVS Health, and Madison Miller, who's lived this transition herself. Welcome to the show, you two. How are you?
We're doing well. Thank you for that warm welcome.
Hey, Dan. Great. We're doing great. Thank you.
Madison, you just went through this. Can you tell us about your experience moving from pediatric care to taking care of your own health?
Yes, I have cystic fibrosis, which is a chronic genetic condition, and that required me to take on a lot as I transitioned from pediatric to adult care. And the challenges I faced looked like getting to know my insurance plan and navigating that, getting to know my medical care team and learning how to refill prescriptions on my own and schedule appointments and attend those appointments. So I learned that as I moved forward and did all of these things, that it is possible to do them confidently, and we are all capable of doing that and navigating our healthcare, even though it may seem uncomfortable and scary at first, as it was for me. So I encourage others to move forward with perseverance, know that you're able, and don't be afraid to ask for help and get to know the resources and tools that are available for you.
And Lucille, even for young adults without a chronic illness, why is it important to understand how the healthcare system actually works?
Yes, research has shown that transitioning from pediatric care to adult care, especially in healthcare, is quite daunting for adolescents. And there's an encouragement here of just empowering them, getting them confident. As you could see with Madison, she's leading the way on her own healthcare. And it's really starting that first view of maybe even like refilling a prescription, starting there. And it's so important to stay on your medication and take it as directed by your doctor. So critical outcomes in just starting there. Getting to know your local community pharmacist, especially, as you navigate a new school or a new job, that's important, moving away from home. And then like Madison, who's on specialty medications, being able to stay connected to your specialty pharmacy and managing the complex therapies that she's on.
And Madison, what lessons did you learn during your transition that might help other young adults get ready for this step?
I learned the importance of building a supportive team that I can lean into, and that included family and friends, getting to know others with the same condition as me that I could connect with and really bounce off of, and connecting with my pharmacist and the like. So I encourage others, find your supportive team, get to know tools and resources that are available for you. Check out some articles online and remember that healthcare is an important thing to look after, and it is worth educating yourself on that and building the skills that are necessary as you move forward into a new season of your life.
And Lucille, what practical advice would you give parents as they help their kids prepare for the move from pediatric to adult care?
I would say start early. Start at age 12 to 14. Give them the ability to refill a inhaler, a prescription that they take. Get them comfortable scheduling their healthcare, a physical, maybe for sports or for school. Give them that empowerment, that confidence that they can take on some of these tasks on their own, building that structure in order for them to carry on to college and on to their own personal lives. I would also say staying very connected to your CVS pharmacist or your local pharmacy. Download the technology. This particular age bracket loves tech. And, as Madison mentioned, she does her refills, and I know she does them on our digital app. So that keeps her up to date and up to speed on where her therapies are. And then again, and if a patient or one of the individuals has a specialized care needed for specialty pharmacy, obviously staying connected there with your pharmacist and being able to manage the complex condition that it requires.
And for families who want resources or support in this area, where could they go?
They could go to cvshealth.com.
I want to thank you two for joining me this morning.
Thank you for having us.
So what happens when law enforcement uncovers a plot bigger than anyone ever imagined? Well, that's the premise of Countdown, Prime Video's Edge of Your Seat action series. Two of the stars join us today. That's Elliot Knight and Uli Latukefu, who are here to give us a behind-the-scenes look towards the explosive finale. Welcome, Elliot and Uli. How are you two?
Hey,
Thank you, dude. Good, man. Good. How are you?
I've been doing okay. I've been checking out the show, and it moves fast, and it keeps viewers hooked. What was it about Countdown that made you both want to be part of it?
I'll go first. A combination of things. It was, one, an opportunity to work in this genre. 2, being able to work in Los Angeles, which is great, and 3, we'd just come off the back of a strike, so every bit helps.
Yeah, exactly. And also, to work with Derek Haas, he has such an amazing track record of the shows that he's made. And there is a really beautiful element of this show that's like, honoring those classic fun action movies and that whole genre. To do that in TV in sort of a new age and for a new audience is really an honor. And that's been a lot of fun too.
Elliot, your character is caught up in this secret task force. How did you prepare for that role and the intensity that it brings?
I think focusing on the stakes, what the real world stakes would be with what the task force are focused on. This is a deadly threat to the city of Los Angeles that could wipe it off of the map. It's something that should be unbelievable, but there are people in real life who have to consider those consequences. And so I think making sure that as the character, he's focused on making sure that does not happen, but also there is fun to be had, and you still have to be a person to do that job. It can't be dire all the time. So finding that balance of dire stakes, but also explosive fun as you go along has really made for an incredible ride, and hopefully one that translates on screen for everyone to enjoy as well.
Uli, you've had such a wide range of roles from Young Rock to Black Adam. What stands out about your experience on Countdown?
Oh man, we had so much fun making this show, and especially given the genre, it's things can get a little intense, on the show, but it didn't feel like that at all for this. And working with this team has been amazing. Being able to work in LA, I live in LA now, and it really has been a dream come true. I'm sure Elliot will echo the same sentiment. In terms of, I've never been in a cop show like this, an American cop show, which was always fun. It's always kind of been on my bucket list to tick off, and hopefully we can continue to do that for years to come, because we've had a ball making it, and I think the show's great.
And the cast, it includes some big names like Jensen Ackles and Eric Dane. What's it been like collaborating with them on set?
Jensen's amazing and a great leader for our team. He brings not just such skill to the role, and he really is Mark Meacham in so many ways, which is so fun to watch him play out, but also he's led the fun and the camaraderie that we have on set. He's made sure that we all know how lucky and grateful we are to be doing this, and to make sure we enjoy every moment. And honestly, even like Eric, he has a much more somber role in the show, but he brings his own personality and element of fun to work as well. And it really adds to the joy we get from doing this job. And then I think the product on screen is clear. This is a group of very, very talented people, and especially the big stars amongst that too. It's amazing to get to share in that with them.
Yeah, agreed.
Hey, I want to thank you too for hanging out with me today. Catch new episodes of Countdown every Wednesday, only on Prime Video, and don't miss the season finale streaming September 3rd. Hey, I want to thank you too for joining me today.
Appreciate it, brother.
Thank you so much.
And that's it for New Mexico Rising. I want to thank you for tuning in and checking out the show. If you actually want to be on the show, just email me. That's newmexicorising@gmail.com. Go to our website, newmexicorising.com. Follow us on Facebook, Instagram, or follow us on our YouTube channel. That's @NM Rising. Make sure you like, comment, share, subscribe, all that other good stuff. And until next week, that was New Mexico Rising.